Welcome to QD Clinic. Hi, I'm Jack Cushwood. Room Now. QD Clinic is brought to you by our PsA All the Way campaign for the month of April, where we're talking about cases with psoriatic arthritis. Does this case have psoriatic arthritis? I don't know. What do you think? 27-year-old gal comes to me with initially an acute onset of an asymmetric oligoarthritis with knee swelling, mainly a knee effusion. No recent events, no new medicine. She had a URI about a week ago before this. She came in with about 3 weeks of swelling. No history of dysuria, discharge, sore throat, diarrhea. She did have some arthralgias, myalgias, and whatnot, and mainly involving the neck and arms, but also the hips and wrists. But really, she only has a knee that's swollen. So she gets treated symptomatically with nonsteroidals, and we do some lab tests. She comes back about 2 months later. Now she has 2 swollen knees. Interesting. She did not respond very well to meloxicam 15 milligrams a day, nor to a 2-week course of prednisone. She does have a family history of psoriasis. So when you examine her, she's got 2+ effusion on the left, maybe a 1+ on the right. She has tender fourth, flexor tender, palmar tender, fourth finger, flexor tenderness, probably a tenosynovitis, but no palpable swelling. But it certainly is tender with movement and also with palpation. Labs, the rest of the exam is normal. No Achilles tendonitis, no enthesitis, nothing else going on. Labs, totally normal. UA, CBC, CMP, uric acid, 5.6. Her ANA is 1 to 160 speckled pattern. Negative tests for rheumatoid factor, CCP, SED rate, CRP were normal. B27 was negative. ACE, angiotensin converting enzyme, and parvovirus B19 IgM titers were normal. X-ray only showed an effusion. Due to the chronicity, we got an MR. No mechanical derangement. No cartilage damage, no cruciate damage. So the question is, what are you going to call this? How are you going to treat this? Actually, I have the advantage of having a few people follow me on social media, so I did a Twitter poll. I put this poll out there, and in 24 hours, I got the answer to what 100 people on Twitter think. Who are they? Are they plumbers? Are they rheumatologists? I don't know. That's the risk you take with Twitter. But I asked the question, 27-year-old, she's got bilateral knee effusions. I gave them the lab results. What do you think this is? The options they had was seronegative RA, incomplete lupus, occult PsA SPA, or PsA JIA in the adult. What do you think was number 1? Number 1 was occult PsA and SPA. You could also say occult IBD maybe, with about half of the people believing that was the right diagnosis. Next most popular answer was 24% with seronegative RA, 21% with adult onset PsA articular JIA, and only 8% said occult lupus. So I ended up treating this as if this were something called psoriatic arthritis, Sine psoriasis. Latin sine meaning without. So can you have psoriatic arthritis patients who don't have psoriasis? It's pretty uncommon in the adults. No one has a hard number, but it's a single-digit number. It's less than 10%. In kids, however, juvenile onset psoriatic arthritis, it may be as much as 20%. Certainly it's more than 10% of juvenile psoriatic disease. And it's basically just like this. It's asymmetric, it's oligoarticular, it's rarely polyarticular and rarely axial. Some have found associations with the genetic marker CW6, and they may have evidence of either finger involvement or dactylitis has been described. Obviously, when you see such cases, you have to do the the exhaustive search. You got to take off their pants. You got to look at private parts. You got to look at the crack of the butt, the belly button, examine the toes, which, yes, means removing the socks and, chancing it with the toe jam. But, nails need to be looked at in those unusual places behind the ears, in the scalp, private parts, crack of butt, belly button. And I have found over the years that a quarter of young adults in whom I suspect psoriatic arthritis do have psoriatic lesions when I start making a really hard search. But in this particular gal, no such findings were had. She was treated initially, wanted to go light. She was treated with hydroxychloroquine, did well for a while, then not so well. We went on to a TNF inhibitor where it all went away, never came back. She's young and foolish and wanted to go off of the TNF inhibitor. She did. Wanted to go back on hydroxychloroquine. She did. And you know what else she did? Yeah, that's right. She flared again. So we're playing a little game right now. Luckily, she has mild disease. And we keep asking the questions. Do you have any new skin lesions? Do you have any new bowel problems? Do you have any new back pain? Do you have any new eye problems? These are the things you have to go through. But until something else reveals itself, this is, in my humble opinion, PsA Sine psoriasis. Tune in for more great cases on QD Clinic.